My name is Dr. Jill Elliot. I'm a veterinarian at West Village Vet on 14th Street and 8th Avenue. My specialty is holistic medicine. And I also use conventional medicine whenever it's necessary, but I like to start and try most things with holistic alternative medicine whenever possible. And one of the modalities that I do use is homeopathy. Homeopathy is a 200-year-old science. It was invented by a physician, Dr. Hahnemann, in Germany 200 years ago. And it's used really as the second most used medicine around the world, except in the United States. And the reason for that is the pharmaceutical industry in the United States totally wiped out the homeopathic schools. We had 27 homeopathic schools here. But because there's no profit in homeopathy, in homeopathic remedies, they just wiped us out. And so there's a lot of misunderstanding about homeopathy. There's a lot of foo-foo, it can't possibly work, all of that. But the truth is, it absolutely does work. And I'm going to talk about it today. Theory in homeopathy is that like cures like. And let me back up a little bit. So I was trained extensively in homeopathy. There's a Dr. Richard Pitcairn, who's a veterinarian, who trained most of the veterinarians today that do homeopathy. And there aren't too many of us, but he did training. He's still training. There are other people doing training now. So I went to all of his training, his initial, I think it was 5 sessions. I went to Boulder for 5 days for 5 times throughout the year. Then he had an advanced course, and I went back again to Denver, and we did 5 days for 5 sessions for the advanced course, beginner's course and the advanced course. And then I was very interested, and I started using it, and I loved it, but I still felt that there was a lot more to learn. So another person who was in the class with me, another student, and I decided that there was a course in London, the Orion School, which was a postgraduate school for homeopathy. And in England, their physicians go to school for 4 years to learn homeopathy. So this was postgraduate, after they graduated their 4-year course. And this was 1 weekend per month for 5 months. So it really opened up my eyes and my colleagues' eyes as to expanding all the remedies that were in the whole package that we could use, and there are thousands of remedies. Came home, and then I registered in a 4-year course in New York City in a course called Teleosis. And this was a homeopathic school for people who treated people. And the last 2 years of that course, Saturday we'd have class, and Sunday we would treat people. And then we would talk about the case afterwards. The patients mostly that came were patients from my practice that I was using homeopathy with their animals. And they would all ask me, well, where do I get treated? And so again, I saw miraculous cures with these people. And one of the clients that I saw there is still a client to this day for her dog with me, her dog and her cat. And she comes to West Village. And she totally had a life transformation. That's my training. So I feel very well versed in homeopathy. I'm the middle of the roader. I don't believe a lot of homeopaths were trained, especially by Dr. Pitcairn, that you had to stop all conventional medicine if you were using homeopathy, that it would not work if you used conventional medicine, even steroids, while using homeopathy. And I don't believe that. I believe you need to use certain medicines. You use them if you have a diabetic, you need to give insulin. If you have seizures, you need to give the phenobarb. But whatever you need that's necessary, do it. And I have no problem with that. So I use it in conjunction with conventional medicine. So the theory is like cures like. So for instance, the remedies themselves are made up from products from original sources. So animal, mineral, plant sources. So you would take one part of the original source, put it in 99 drops of water, succuss it, shake it, let's say 100 times. Then you take 1 drop of that, put it in another 99 drops, shake it. And the times that it's shaken and the amount of times establishes what potency the final remedy is. When you finally have the potency you want, you then pour that over a bunch of sugar pellets, and you then put that in a bottle. Sometimes they just use the liquid. It depends on what they decide to make up. So the sugar pellets actually are not the remedy, it's what's poured on them. When you're shaking it all those times, you're actually, if you then took the final product to a chemist and said, here, find the lycopodium, the plant, in here, the chemist would say, there's nothing there, it's nonsense. And that's why people don't believe it works. But what you have is actually the energy of the product. And the energy, it's considered energetic medicine. So people think it's foo-foo, it doesn't work. So the energy of the product actually corresponds to the energy of the person or the animal. And incites them to cause the cure in whatever the problem is. So let's say you have, for instance, an allergic reaction to a bee sting or an allergic reaction to a vaccine or anything. The remedy that I use is called apis, and apis is made from the venom of the honeybee. So the honeybee can cause an allergic reaction. But if you keep taking apis during that reaction, it actually 99% of the time will stop the problem. So you just give it frequently until it stops. But I say to people, on your way to the vet, don't just sit home and do that. On your way to the vet, be giving the apis. And so when you get there, the dog may be fine, still should be checked out by the vet. But it does work. My partner was stung by a spider, and he had this red line going up his leg. We were in the house. It was about 8 o'clock at night. And I was watching this red line go up his leg. And I said, if it gets to your knee, he was stung on the toe. I said, we're going to the hospital. So I was giving him apis every few minutes, and it got just below the knee and started going down. I've seen it work with people. I've seen it work with animals. For an emergency, and we'll talk about acute versus chronic later, but for an emergency, it works very quickly. Let's say a dog that's having seizures. There's an emergency remedy called Belladonna. And I find if you give that either before you see an aura, patients having an aura, some dogs will do funny behaviors. One dog used to run around in circles. Another dog used to jump up on its owner and start jumping all over her. If you give it at that point, often it will stop the seizure. If you give it during the seizure, it may stop the seizure or at least make it less intense. So there are certain things that really work. For emergency, that's for acute. And we'll talk about it again, we'll talk about that. When you have chronic problems, what we try to do is match the homeopathic remedy. We try to do a constitutional remedy, which means something that matches the symptoms and matches the personality. So if a person was going in to have a conversation or a consult with a homeopath, you spend 2 or 3 hours talking to the homeopath, telling them your fears, your hopes, your complaints. From that, they put together your general personality, and they see what other symptoms you have and what goes together. And then they'll suggest one remedy that can help bring all that together and help to cure that. Homeopathy doesn't act like prednisone, which will submerge the problem. It actually says, go fix yourself. You have this issue, your body's not fixing it. Wake up and go fix it. So you don't want to give them both at the same time because it's you're telling them to wake up and you're telling them to suppress. So you try to just give it without any other medicine. For chronic problems, I'm trying to get the whole problem. And then I'll usually give a remedy. Sometimes I give it once a day for 3 days and then wait for response and wait for the person to get back to me. Sometimes I'll give a remedy once a week. It depends on what the issues are and what I'm looking for. There are many books that I suggest to clients they can buy and work on, see what they think they can do on their own. There's a book by Don Hamilton. He's a veterinarian, called Homeopathic Care for Cats and Dogs. Excellent book. It has a very good beginning. It gives a good introduction. And he'll talk about what the conventional treatment is, what the holistic treatment, what supplements you can do, and homeopathic treatments that you can use for certain problems. Another book by George MacLeod, who's a veterinarian in England. He has one homeopathic for cats, homeopathic for dogs. Excellent. You just turn to the problem, urinary tract problem. You can figure out, he'll give you a little way to figure out which remedy to use. And then there's an excellent book by Asa Hershoff, which was one of my teachers, called Homeopathic Care for the Musculoskeletal System. He was a fantastic homeopath. And so it talks about joints and spine and arthritis, and you can figure out what to do. I always recommend my patients get some books, have it at home when the problem happens at 3 a.m. on a Saturday. Perhaps they can solve the problem if they buy a couple of remedies in advance to help themselves. So it really works. And I also give handouts to my clients about emergency remedies to have in the house. And I think this is really important. I think every patient, every client should have a little homeopathic pharmacy because, and by the way, the homeopathic pharmacy still sell kits with 50 remedies or 30 remedies. And so you should have them in the house. And a lot of my clients do. So if they say, I'm having this and this problem, I'll say, oh, go give a dose of this. And they have it. If not, they can certainly buy them. There are some pharmacies in New York. Whole Foods sells homeopathic remedies. Wilner's sells homeopathic remedies. And my favorite is Bigelow's. There are certain problems, and I give out a list of homeopathic emergency remedy suggestions. One that is the most important thing to have in the house is Arnica. Arnica is like the big pill. Arnica is the big bullet. It's like homeopathic aspirin. And you can get it in different potencies. So there's a 30C, there's a 200C, there's a 1M. For pain, I usually go with 200C or 1M. But if you can only get 30C, use it. We also sell Arnica cream, which I use on my body, but with animals, it's not effective because You can't really rub it on the skin because they have fur. So I use the pellets. I usually make them up for animals in water so that it's easy to just shoot in the mouth and you don't have to do the pellets because they'll spit them out. So I use 3 pellets in 2 ounces or 4 ounces of water, stir it around till they melt, and then just squirt some in the mouth. You can use a dropper full, you can use a 1 cc syringe, you can use a teaspoon. It doesn't really matter how much water you use. It does not have to be swallowed. As soon as it touches the mucous membrane, it's gotten. Another way you can do it if an animal is fractious and you don't want to put anything in its mouth. So you can buy one of those small spray bottles, make it up in the spray bottle, shake it, spray it on the anus under the tail. The anus is a mucous membrane, so it's the same as the mouth. And if he turns around and licks it, all the more better. There are so many ways, especially if they're having a seizure. You may not want to put anything in their mouth. Pick up the tail, spray, spray, spray. It's done. So it's very simple to administer for any animal, fractious or not. For arnica, I always tell people to have arnica. I don't travel without it. I always have it in my pocketbook if I'm traveling. After any surgery, after a dental procedure, after any trauma to the body or mind. So you run into a wall, dog gets hit by a car, you hurt your back, any pain whatsoever anywhere in the body, arnica is the first line to use. I use that extensively and I recommend it. So that's the one everybody should have in their house. Any kind of bleeding, 2 remedies come up really strong: Phosphorus and Hamamelis. They can stop bleeding. I used to use it after a dental extraction. You put a few drops in where it's bleeding and it will stop. Bloody nose, animals having bloody nose, you can just give Phosphorus, and you can give it that mixture. You can do it from the same mixture, and you can do it every 5 minutes. If it's a real emergency, you can do it every 5 seconds. Any allergic reaction, as I just mentioned earlier, apis. Anybody allergic to bee stings or anything should carry it in their pocket. Any kind of, after vaccine, just give some apis if there's any kind of reaction, and keep giving it till it goes down. So there are all these different emergency remedies that you can use. And there are books written that you can buy, and I don't have a list of them. It just talks about emergency homeopathic remedies. So I use it constantly. I educate my people when they come to me to use it. For chronic problems, it's very good. By the way, I wanted to mention one other thing. There's something called Optique 1, and it's an eye drop for homeopathic eye drops. It's very good for eye problems, not major eye problems, but like conjunctivitis. I woke up the other day, actually here, and I had a redness, and I felt like I was getting a stye in my eye, and I just used it for a day or two and it went away. So it's called Optique 1. You can buy it in any health food store, and it really works. Again, that's something I travel with. Emergencies, but the Don Hamilton book will have all that, and the George McLeod book will have all that. And, there's remedies for vomiting, diarrhea, everything. So it really would be good to get a book that talks about, for chronic problems, it's more difficult. The treatment is more, it takes longer. I have a computer analysis program, and I really try to figure out what's the best approach. I also use different remedies to support organs. So if there's a kidney problem, liver problem, I may use a remedy just for that. And I usually do that in a liquid form, so I give it every day and a few drops on the gums. But these things really work. And again, I've seen tremendous improvement and tremendous cures. The one other area I use homeopathy with a lot, and I get an awful lot of clients, is for cancer. What homeopathy does is it can extend the life and slow down the progress of the cancer. He's a homeopathic physician in India, Dr. Ramakrishna, who invented this method called the Plussing method. And he used to fly all over the world treating people. He invented this method that absolutely enhanced statistics, improves either takes away or improves the prognosis by 60 or 70% over every other method of homeopathy anyway. I use this method. I employ this method. It's very, very, it's easy to use, but it's a little time consuming, but it does work. And I have many, many clients with cancer who are long outliving their prognosis. Usually if the prognosis is, let's say, 6 months, we get them a year. I had one dog that came in years ago with a splenic tumor, and they didn't want to operate. The dog was an older dog, and they didn't want to put it through surgery. And we just used homeopathy, and that dog lived 4 years, which is unheard of. I had a little dog who had leukemia, and we kept doing the white blood cells, and it would go up and down, up and down. But the dog was happy, healthy, playful, eating. I said to the woman, let's stop doing the blood work because we're just doing the homeopathy. The dog is fine. Forget the blood work. It doesn't matter what it says. And that dog also lived about 4 years. Once in a blue moon, I have seen a mass fall off, like a mammary mass. So I do use it. I have a lot of patients come in for it, and I highly recommend it. By the way, some of my patients also do chemo along with this, which I have no problem with. And I tell them, just don't give a remedy on the day of chemo because it won't do anything. Chemo is too strong. And then I give them a certain remedy after chemo, which tends to lessen any bad effects from the chemo. And the clients do it and they're very happy with it. And we send home usually 2 remedies with the homeopathic consult. The first one's included in the consult, and the second one, there's a small charge. And the remedies we send home last 5 to 6 months.